Hello everybody, thank you Sarah. So yeah, I'm Sam Montel. I'm in the national PHE team in the obesity and healthy weight team. I'm a registered public health nutritionist, and some faces I know are familiar to me. So today I'm going to talk about the programme of work that we've commissioned from PHE along with our partners, the ADPH and the LGA, to take a whole systems approach to obesity and what that means at a local authority level. We're halfway through the programme, so it's a good time to give you a little bit of an update of where we are to date at the moment. First of all, I'm going to start with the sort of upstream, downstream. And Sarah's spoken about this already a little bit. This slide is taken from the 2011 Lancet series on obesity, so from Boyd Swinburne and partners. And this kind of shows where obviously the focus is at the moment. It's very much, as you can see, on individual level behaviour change and treatment, because we can see there that that's where the evidence base is, that's where the political mandate is, that's where the public media political discourse is, although obviously from the Great Weight debate and the social attitudes survey we see that the public discourse is changing to what they would like us to be looking at. We hear a lot about moving upstream, and obviously that's where there's the biggest population level effect, but that's where it's more difficult. You've talked this morning, some of you, about looking at sort of the out-of-home food sector, and I've worked recently on the PHE resource and the strategies to look at a healthier out-of-home food sector that we released, working with CIEH and partners. And I think there are opportunities there for working upstream. There are certain issues that obviously are within the local authority gift. There are certain issues upstream that are within the national government gift. And I think it's recognising that actually it's not doing upstream or downstream, it's actually being able to do both. And from looking at this slide, it's being able to balance our actions across the upstream, downstream, because obviously we still want to support those individuals that are at risk or are already overweight or obese, because we know they are the majority of the population now. And actually we want to be able to have those services there to be able to support them to be able to do so. I think the other thing to say really on that one is that from Public Health England's point of view, we do recognise, we're very clear that getting the right mix of interventions is a challenge. And as we hear constantly, there isn't a single solution to that. And just to say really that we do recognise the challenge of that's there at the moment. I mean, that kind of gives us the overview really of obviously tackling the environment and why we're looking at systems ways of working, why we're looking at actually what we need to do to be able to change the system so we can have that sort of obesogenic environment tackled, so that we move towards a more sort of leanogenic, if you like, environment going forward. So I'm just going to give you a bit of an overview. I'm sure quite a few of you are aware of the programme that we commissioned about 18, 19 months ago now. It's very much about obviously sort of supporting the vital leadership role that local authorities have in tackling obesity. It's about, you know, taking what Foresight set out in that spaghetti diagram and actually thinking through, what does this mean for me? What do I actually have to do? Because I think there's a lot of jargon around systems working, you know, and it takes quite a lot to kind of cut through that in order to be able to know practically what does it mean for me and my role and my job and what I have to do. Understanding what that means for us practically on a day-to-day basis. And certainly this programme of work looks to do that. We're working in co-production and co-development with our pilot local authority areas, of which Gwenda's going to talk to you about later. But we're also working very much through our community of learning, and please have a look at the website and join that community of learning, other local authorities. And we're engaging with other local authorities to test out some of the thinking, the tools, all along the way. It's not just restricted to those 4 local authorities, and I know that some of you in the room would have put in an expression of interest to be part of that as well, and we'd welcome your continued support with that. As you can see here, it's very much looking at a different way of tackling obesity, and it looks to develop a whole systems support and which is transferable across any local authority in the country. just as a bit of background to where this programme of work came from actually, which is important, when PHE first set up, we did a survey with directors of public health, and we looked at what the focus that they wanted to have, and certainly this is where that came from. They wanted us to look at how we could actually translate foresight and how we could actually support local authorities to make this happen in practice. So I think that's just an important thing to recognise. So this slide here really shows what's the difference. You know, maybe at the moment you're already doing what you consider to be superior, you know, collaboration, you're networking, you're tackling obesity, you have a series of interventions. What's going to be the difference to actually taking a systems approach? What does it mean? Well, this is some of the learning that's already coming out of the programme to actually, what does this mean that I would do differently, and why would I do it? And I think if you start to look through those, we can start to see where those differences are. So, for example, we're looking at integrating the whole system. That's obviously implied in the title of what it means. But we're looking at actually how we can involve other partners, how we can make it more dynamic, as in we revisit it more often. As you can see, we often take a very much a linear cause and effect. We find a problem, we look at the evidence, we find something to do, we evaluate. It's a linear line of working, and this is very different. It looks at dynamic feedback loops, and what that means is the spaghetti map that we always see from foresight with all those squiggly lines in it, those are feedback loops. That's showing the correlation between one thing and another and whether it has an effect. And we're looking at ways and approaches of actually making sure we revisit that and constantly, because obesity in itself is changing all the time, and at the moment we don't necessarily have a system that can reflect that constant change and revisit. And it's looking at ways we can do that. And I think very much this is looking at a mindset and how we change the connectivity and networks that we currently have. It's looking at how we move outside perhaps our normal comfort zones of who we talk to and who we involve in that. This whole thing about it being everybody's business, we really want to take that seriously. We're looking certainly at tools where we can support you in your negotiations and your conversations with other departments. How does it tick their priorities? What's it going to do to benefit them? How does obesity become not just a public health issue, which I know is hard because in a sense it's not always the levers for the system we need that are in our gift as public health, but it's a kind of acceptance of that. The human and relationship aspect is important. It's an honesty about that there are aspects of the system that aren't working because the status quo of what we're doing at the moment we know isn't making the effect of what we need. And so it's actually having that honesty and building that trust and relationship with other partners so that we can take those risks and try and change the system a bit. Very straightforward objectives. As I've already said, this is a bit of the how and a bit of the what, really. It's how we weave systems approach into what we do. The mindset's really interesting, the second bullet there, I think, because it is about different ways of working, and it is about ensuring that we think of a medium and long-term approach, and that's really hard. And it actually then comes into that whole senior leadership buy-in and how we get that to actually start to take that forward so that we can have long-term planning to work differently. As I've said, we're looking at how we can do this in practice, and actually how we can do this from a mindset that means that we also have an adaptive mindset to evolve our thinking and being able to do things differently. And again, that's outside of our comfort zone. That's not always easy. The tools will be there. We will look at how you can use a route map, which is how we're phrasing what we'll deliver from this programme, and how it will signpost tools to it to actually how you can start to take that process yourselves or build on a process, because I know a lot of you are already starting to work in a systems way. This is the approach that Leeds Beckett University, who are taking the programme forward for us, are doing. It's an appreciative inquiry, so that means it's looking at what works well. It's positive. It looks at actually, let's build on what you're doing that is actually successful and is working well for you. So you can see there that there's a 4-stage approach to how we're working with the 4 pilot areas. We're currently at the 3rd stage, so if I quickly whiz through actually what that means. The discovery phase, which is the first phase that the pilots got involved in, was about creating the right environment for change, for how we do that. And that meant making sure you know what's going on for your locality. What is the data? What's the prevalence? What are the networks? What's the senior level buy-in? And so forth. The dreaming phase as it says really, where do you want to be? And how do you do that? What are the causes of obesity? Where are the levers? Involving your networks and partners, so some real work on actually how you involve the partners you need to for the system you want to change. We're currently at designing, and that means we're going to start action planning and prioritisation, because this doesn't necessarily mean you're going to tackle the whole system all at once. We recognise the limitations to capacity, and that actually you will need to be able to do some prioritisation within that. And so that's working through how that would happen. And then we'll go on to delivery in those final stages. So it looks very much the programme at international practice, published evidence, as well as the local practice and examples we have from you, and other local authorities are already starting to take a systems approach as well. And it looks at actually how we can involve all of that together in to make sure what we deliver is something you can really utilise. I'm going to leave most of these key lessons with you to reflect on and not go through them, but just to pick on a couple of ones, certainly the first bullet there. All pilots are interested in the connection with economy, growth, and it therefore relates, I think, to that sell obesity to the non-public health stakeholders bullet there as well. It's again, it's how you make sure that you're getting across the investment and benefit to others. And I suppose, again, as I was saying, how you can tick their boxes for the priorities, how that can benefit them. And I think there's probably nothing there that's surprising to any of us, but these are sort of things that are starting to come out now, actually, for how we're using that in our learning for the tools that we're developing. In order to take the programme forward, we looked at what the definition would be, and certainly defining of a whole systems approach. And I'll leave that again with you to look at. I mean, we've been through those points, and I think also to say is that we look very much at defining how you can define the system you're working in, because obviously some work on a school system and they define the whole systems approach from that way. For us, for our local authority pilots, it's a local authority system. So again, there's scope there to think about how you would be doing your working. This is the route map. So this is, as I said, how we're defining or presenting the tools that we will be finally putting out to local authorities. And this relates back to that appreciative inquiry four-stage approach. So you can see there you've got the pre-systems work, which is something obviously that sets the scene. Boyd Swinburne, who developed that upstream, downstream work that I showed you at the beginning, calls it sort of back of house, how you get everything in order, ready that you can make that change effectively. And then you can see there that you go through those different stages around how you sort of look at the opportunities to getting to think about how you maintain a dynamic system. And we're often asked, as I said right at the beginning, what's the difference to taking a whole systems approach to what I'm doing already? And I think it's the dynamic system that we find generally is missing. And that's where, you know, perhaps, as I said, we develop some work and we don't necessarily continuously revisit it every 2 weeks, every 4 weeks, every 6 months. Mostly, maybe it's an annual thing at the moment that we do. There isn't a dynamic relationship there with our partners. You know, we're kind of leaving to get on with. And it's that makes the difference. And it's actually, how do you do that? So that's something, obviously, that we're exploring, because that's kind of something, as I said, that is important to keeping that alive and agile, to making sure we can tackle obesity in the way that we need to. At the moment, Leeds Beckett University are working with the pilots and other local authorities to refine the process and to develop a logical but agile set of tools that you can use in practice. Just to conclude on the next steps for the programme at the moment. So the field work continues with the pilot areas. We're looking at publishing a systematic review, probably in the next sort of quarter. And we're also, at the moment, working with the LGA and the pilots, and I know some of you have been involved in this, in preparation to publish an elected members briefing on taking a systems approach. And this comes into, again, what we've been talking about, ensuring that we have senior leadership buy-in and actually how we do that. So we're working on that at the moment. We've talked about looking at the case for obesity or policies, and we're looking at those, what we can support in that as well. there's a lot there, and obviously the systems leadership is really important, and again we're looking at opportunities there that we can explore. So quite a lot going forward at the moment, and obviously if you join the community of learning, there are regular updates outside of the election period when we can do so, and information there that can support you. And actually it's a sharing tool, so what we've been really enjoying is listening to those local authorities who are already working on systems leadership and systems approaches going forward as well. And just, I suppose, to say some of you have been involved in the this morning's session around looking at the out-of-home sector, and I think, you know, there are ways to think of starting small with something like working with the out-of-home sector and bringing to that a systems approach. Wouldn't necessarily mean, I think, because it can feel quite overwhelming, is actually you could start small and do something like that and think, how do I bring all the partners involved? How do I keep that going dynamically? How do I work with my stakeholders and start to work through it, and that then can be translated out. And systems approaches can be there. Obviously they've been working in other sectors. So once you've kind of got that going for obesity, it can roll out to other areas of what you need to tackle. So thank you. Thank you.